of the expected essay questions in forensic medicine and toxicology. So, number one question, what I'm expecting is regarding malpraxis. What is malpraxis? Define proof of medical negligence. What are the defenses available by medical practitioner in a case of negligence? What are the defenses in civil negligence, defenses in criminal negligence? That's the first question. Second question, injury. What is the medico legal definition of injury? What are the different types of injuries, that is abrasion, contusions, and laceration? What are the criteria for saying that an injury is grievous hurt? Okay, there are different clauses mentioned in our constitution to say that the injury is a type of grievous hurt. So what are those clauses, or what are those criteria? Then what is the medico-legal importance of injury? Yes, with saying the injury, whether we can say what will be the nature of the weapon or the type of the weapon used to produce injury. That is the second question. Third question, from the chapter Mechanical Asphyxia, I am expecting number one, what is asphyxia? What is the definition of asphyxia? Then hanging, strangulation, throttling. So hanging, typical, atypical, throttling, and strangulation. In strangulation, manual strangulation, then ligature strangulation. What are the postmortem findings which help us, salient postmortem findings that help us to differentiate these three what types of asphyxia? Then another one, for the fourth important question is, I'm expecting drowning, freshwater drowning, saltwater drowning, which is more dangerous? Always it is freshwater is more dangerous than seawater drowning. What are clinical or the manifestations which is responsible for death in each of these type of drowning? What is dry submersion syndrome? Okay, what is the cause of death in dry submersion syndrome? What is the cause of death in case of yeah, dry immersion syndrome? Okay, so drowning, asphyxia, that is always a potential questions in the university. So make sure you read top to bottom about what are the findings to say that it is an antemortem drowning. Okay, diatom test, edema aqueosum, emphysema aqueosum. Okay, what is the medico-legal importance of diatoms? That is a very potential question. It can be asked as a short note also. Okay, the medico-legal importance of diatom, Jetler's test. Okay, all those are very important. Then another question I'm expecting is carbon monoxide poisoning. Yes, this question seems to be a bit new for you, but remember, in toxicology, carbon monoxide poisoning, what are the clinical features of carbon monoxide poisoning? Okay, is very, very important. That is the lethal blood concentration level of carbon monoxide. They will give a history of a patient who is sleeping or getting locked within a car. Okay, dying after some time, or dying on the early morning. Okay, there will be cherry red type of postmortem sagillation or postmortem ebesis, or postmortem hypostasis. Okay, all these are important. Then the next question, so please do read about carbon monoxide poisoning, even though it is discussed a little in your small in your textbook, but I'm expecting carbon monoxide poisoning this time. And next is, yes, abortion. What is Medical Termination of Pregnancy Act 2021 amendment? Okay, when all or at what time period we can do medical termination of pregnancy? What are the medical ways in which we can terminate the pregnancy? That is, in the first trimester, what are the methods used? Second trimester, what are the methods used? Then criminal abortion. Okay, and IPC is related to that. Fine. Yes, and the medical legal importance of criminal abortion. Then another question I am expecting is a very straightforward question: OPC poisoning versus atropine poisoning. Okay, cholinergic versus anticholinergic poisoning. So there is a straightforward question you must know. Okay, there is no compromise in these two questions. Then next question is poisoning classification of poisons. How will you manage a case of poison? That is using what is physical antidote, what are chemical antidote, what are physiological antidote. Okay, what is the importance of gastric lavage? In which all poisoning gastric lavage is contraindicated. Okay, all those questions are very very important. Then coming to the next question is, yes, time since death. What are the parameters used to determine time since death? Mummification, saponification, postmortem caloricity. Okay, then what? Postmortem hypostasis. So there are a lot of alternate names for postmortem hypostasis. One is postmortem subgylation, postmortem bibisis, okay, postmortem hypostasis. Then similarly, do read about rigor mortis, okay, rigor mortis and cadaveric spasm. Okay, remember cadaveric spasm is one of the salient feature of antemortem chronic. Okay, what is cadaveric spasm? Okay, what is rigor mortis? Both compare and contrast. Okay, there is a differences between these two. Very commonly asked question. Then next, yes, a very rarest of rarest. They can even ask firearm. Define firearm. Differences between rifle, shotgun. Okay. Then features of entry wound as well as exit wounds. Okay. Difference between entry wound and exit wounds. Abrasion collar, grease collar, blackening, singing, tattooing. All these terminologies are very important. In which so depending upon whether it is a near shot, close shot, intermediate range shot, distant shot, all these features, in some it will be present, some it will be absent. Okay, so just go through all those things. Okay, crisp and contra. Don't just read each and every line, but you should have an outline of these points so that when they ask an essay question on firearm, yes, firearm has been once asked in a supplementary exams in your university, so it is a very potential because this year you are having only community medicine and FM. Okay, so carbon monoxide poisoning, I have already mentioned it. And the second question is McNaughton's rule. Okay, examination of a mentally ill person. Okay, how will you, what are the importance, okay, medical legal importance of what a mentally ill person if they do any criminal action? National Mental Health Act 2017. This question I predicted last year and it came. Okay, the same question has came from the National Mental Health Care Act 2007. I predicted last year. This year also I am saying that it is very very important. Forensic psychiatry, McNaughton's rule, Curran's rule, American Law Institute test. What are the difference between all those things? Okay, each law has some certain terms are there. Okay, McNaughton's rule. Okay, what is the IPC which deals with it? And as of now, don't be so much worried about the BNSS and all. Okay, there is a Bharatiya Nyaya Sanhita, okay, because we know IPC, CRPC, everything has been changed. Don't worry much more about it. You just, if you try to read the what some of the most important BNS, okay, not everything. So you can even follow the IPCs only, fine, yeah, because it's mainly for PG exams they are asking this BNSS and all, but for your university exam you can still stick on to IPCs, but at the same time, like grievous heart, rape definition, okay, perjury definition, all those things, some certain salient things around, you just see the BNSS. And okay, McNaughton's rule and examination of mentally ill person is important. Definition of rape, examination of an accused in rape, victim in rape, sexual paraphilias. Okay, so these three are another set of questions that I'm expecting. So forensic psychiatry, firearm is related questions. Carbon monoxide poisoning and asphyxia is important. Sexual paraphilias and examination of an accused and victim in the rape. And the next question is forensic psychiatry. Okay, forensic psychiatry. So forensic psychiatry is a topic or a chapter which you rarely touch. So what I will suggest is you just go for the chapter. Please make sure you read the McNaughton's rule. Okay, what are the medical legal importance? Okay, what is National Mental Care Act 2017 Advanced Directive? Okay, all this. So just go through all these questions once again. Make sure you are reading. You read forensic medicine and toxicology.